Welcome back, guys. Today we are going to see the checklist. This is step-by-step guide for assessment of dehydration. Step number 1, you need to follow the general rules of nursing procedure. That one, providing privacy, washing hands. Number 2, you need to explain the procedure to the patient. If a child, you need to explain the procedure to the mother. Ask the patient or the mother about the following. Number 1, any passing loose watery stool and how many times. Vomiting, the time, the frequency, and then the quantity of the vomiters. Then the history of constant fever. If the child passed urine. So, number 4, you will observe the general sign of dehydration. What are those general signs? 1, you will see if a child is sunken fontanelle, if it is down. Sinking of the eyes. You will also check for the sunken eyes, dryness of the mouth, the tongue, the lips, and feeling of thirst. Then you will pinch the skin and you see the time the skin will take to go back. And then you will test for the thirst by giving the water to the patient or the child, and you see how the patient will be eager to take. And then number 6, you need to check for the dryness and toughness of the skin. You need to take pulse and respiration. If it is mild, counsel the patient or caretaker on increased fluid intake. Then, if severe, perform the first aid and refer the patients to doctor. Thank the patients and clear away. Document the procedure, findings, and the management of the patient. The whole thing is 18 marks. So, in summary, number 1, you need to follow the general rules of nursing procedure. Number 2, you explain the procedure to the patient. If the child, explain the procedure to the mother. And then you ask the following. History of passing loose watery stool and how many times in a day. The history of vomiting, the consistent, the amount also. And then you will also ask for the constant fever if it is there. And then if the child is passing urine. Then step number 4, you are going to check for general signs and symptoms of dehydration, and then those one you will see the fontanelle in the child, and then you see the eyes if the eyes is sunken, and then you will see the dryness of the mouth, the lips, and the tongue. And then you will do the skin pinch if you see the time the skin will take to go back. And then you offer a drink to the patient. You see if the patient is eager to take. And then you need to check for the dryness and toughness of the skin. Take the pulse and respiration. Don't forget that. You just explain everything. This one is a procedure of this one. You explain to the examiner so that he or she knows that you know what you are doing. And then, if mild, you explain and then advise the mother on the increase of fluid intake. And if it is severe, you need to do the first aid and you refer the patient to the doctor or the baby with the mother to the doctor. Thank the patients and clear away. Document anything you have done and the management you have done. That is all. If you get any value out of this video, please consider subscribing. See you in the next one.